This is a recording of Dr. Tom Roselle Live for Sunday, January 30th, 2011. You can listen to Dr. Tom Roselle Live every Sunday from noon to 1 p.m. right here on 630 WMAL.
The following program is paid for by its sponsors, who are solely responsible for its content. Views expressed on this program are not the views of 630 WMAL. Dr. Tom Roselle Live, right now, 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live in studio. 888-630-9625, 888-630 WMAL. That's how you get a hold of me. We're going to talk about some fascinating things today. But perhaps you've had a problem, and you've tried, you've applied, and you've come up with the same old, nothing that really works. Well, this is your opportunity. Call me here. Call me now. 888-630-9625. Sometime during the program, we're going to talk about a very interesting find, something that many of us worry about ongoingly, and that's Alzheimer's disease. You know, there's nothing worse than to look down the road and think that because of, genetic pass-throughs or we've got exposures or whatever it is, that we're going to end up with the loss of total perspective of our conscious state, and that we lose our ability to recognize people, and it begins to degrade our body. So we're going to talk about a very interesting supplementation that seems to have proven to delay the progression of Alzheimer's disease. The story's still out, but I'm going to share that with you. The references are significant, and a couple other things I think that you'll find extremely interesting. I want to remind you that Dr. Tom Roselle Live is brought to you ongoingly by Thermography Centers of Fairfax. If you've been putting off getting a thermographic imaging, you have 2 days left to get their discounted rate for a full-body thermographic scan. Remember, thermographic imaging detects and examines and interprets heat signals from your body that's put out by high levels of inflammatory reaction. So you can see vascular diseases beginning to come about. You can see problems and breakdown in the heart, in the intestinal system, and so forth. But more importantly, ladies, for you specifically, thermographic imaging will show up the beginning stages of breast cancer 5 to 8 years before it can be identified as such by traditional mammographic examinations. Wouldn't it be great to be able to see something before it hits? This is the way to go. Give Dareth Painter a call at 703-943-7248. That's 703-943-7248. And take advantage of their January special. Now, all you have to do is you have to make the appointment in January, and they can schedule out in February. And it's a full body, normally priced at $475 for only $400. Take advantage of it. It's something that I incorporate into my own annual physical examination process and blood work and so forth. I wouldn't go without it. I encourage you to do it. 703-943-7248. Call Dareth and tell her that you'd like to take advantage of it. You only have 2 days left to do that. I would encourage you. Program's going to be fun today. We're going to talk about allergies, but we're going to talk about it from a very different perspective. We want to talk about allergy reactions and sensitivities, and we've done this from kind of different viewpoints before, but I want you to have an understanding that allergy reactions can cause all kinds of problems, and it's not just the runny nose and the sore throat and the runny eyes and so forth, but you can go into some severe conditions. They can affect joint spaces. They can affect autoimmune reaction. They can affect your ability to think and process and so forth. Believe it or not, the warnings when you go into your doctor and says, you know what, you've got an inflammatory process, and you have this tumor, you have this beginning stage of whatever. The physiological and psychological problems that are associated often come about as a result of dampening of the immune system as a result of allergic response. Your body's failure, your body's inability to handle something, in many cases, that is supportive and good for you. How about, if you're allergic to an apple, or if you're allergic to a walnut or something like that, and it's organic, but you're still allergic to it, and you still react, and you don't feel good, and your stomach gets upset, or your joints get stiff, or you have a headache, or suddenly you can't see quite as well as you did. Well, that can be an allergy response, and we want to talk about that. So if you're suffering from unresolved allergies, there's ways of doing it. We're going to talk a little bit about the treatment process, that you can actually get rid of these things if you're willing to do what it takes, and it doesn't take a whole lot of time. Actually, you can get rid of most allergy reactions, most allergy reactions within a period of a few months. And, as long as you don't screw it up again and you don't make things worse for yourself, that brought you around to that place. Remember that when you look at something, you have to look at the body from a structural, chemical, emotional pathway. All those things that happen to you, no matter what they are, no matter how they are, start with either trauma to the body, injury to the hard components of your body affecting the nervous system. They come about because of dietary aberration, sugars, sodas, coffee, teas, fast food, fried foods, alcohol, junk, right? And gluten products because we genetically modify them and they're ridiculous. The things that come into our body from electrical components, we're bombarded with that today. And then stress, emotional pieces. Take a look at your environment. See what goes on. Roll the clock back. See how you were when you were a child. What did you eat? What went into your body? Did you eat things that were supportive, or did you think that was junk? When you're young, your body can withstand a little bit more. You have a lot of replications of cells very quickly. So unless there's a genetic predisposition and at birth, you were already compromised, you do it over time. You do it because of the inattention to what goes into your system. So pretty soon, immune reactions take place and the body begins to break down, and we've got a problem. And that problem often is presented initially as a subtle underlying allergy or sensitivity pattern that just seems to come out of nowhere. But the truth of it is, it doesn't come out of nowhere. It's been building for a long period of time. When we treat these conditions, you have to go to the why behind it. We think of allergies as being hay fever and runny nose and so forth, and we have all these commercials out there that say, take these drugs, and what they do is they suppress the reaction. Years ago, one of the first drugs to come out was something called Afrin, and we used to call it nose dope because it was a steroid substance, and it causes shrinkage of the nasal and sinus membranes. Well, it got rid of the problem while you were using it, but you had to use more and more to do the same thing. But it also broke body systems down over a period of time. And then there was a rebound phenomena that went along with it. Once you stop using it, it just went crazy. The membranes increased in size dramatically, and getting through that process was pretty difficult. It was not an easy thing to do. So we have to look at what causes allergic response. Now, today we're talking about it from a different perspective. We're talking about it from a way of what happens over time, and then ultimately how some of these things can be treated. I've seen patients over 35 years of practice that their back pain, their headaches, their heart problems, their plaquing in the arteries, their diabetes all came about because of inattention to lifestyle. My book, Health is a Do-It-Yourself Program, points that out. It takes you through step by step and lets you understand the things that we're talking about today. It shows you that where we are right now with our health are decision processes that we've made over time, and then subsequently there's a consequence to it. Your consequence is your health condition, the capacity of your body to respond or not respond because of all those things that we've done. So here's the deal. Let's understand it fully. Let's understand that particularly in an allergic response pattern, the inflammatory reaction that kicks in, the suppression of liver function, the inability of the body to get rid of toxins that cause these symptoms because the nervous system now isn't responding properly. The blood supply is inflamed and irritated. The lymph system is toxic and it can't get rid of things. And there's, the acupuncture energetics just aren't working the way that we'd like them to do, that we have a reason. So look at your life. Look at your life as a kid. Were there injuries that really weren't taken care of? You just kind of put up with it over time. Somebody gave you an aspirin or a medication. You were on a lot of antibiotics as a child. Something happened to you, and your doc said, well, just take this. We'll see how that works for you. And subsequently, you totally sterilized your intestinal tract. Did you know in your gut there's many different good bacteria, supportive bacteria, things that make your body work the way it's supposed to, your primary line of defense, your first level production of serotonin, dopamine, the feel-good juices. Everybody thinks it's in the brain, but it's not. It's in the intestinal system. Did you know that your free-chain fatty acids are made by these bacterium, and they protect the intestinal lining? They protect you from things like colitis and tumors and cancers. And when those things get beat up because your bacteria, your good guys, aren't there, then you have a predisposition. How about all the stuff that begins to set up housekeeping? Molds and fungus and yeast. We've been treating those things forever, long before it was popular to do so, because that breaks down the immune system. The mucus secretions of the intestinal lining produce something called IgA antibody. And that IgA is your first line of defense against viruses and bacteria and funguses and so forth. And when that's beat up, your body can't step in. Your body can't do what it was meant to do naturally, protect you. So you go into this state of intestinal permeability. That means the intestinal tract kind of gets irritated and swells a little bit and cracks and fissures, and you don't have the digestive juices that you should have, and you begin to absorb them into the system, and your body reacts. We'll talk about that. We'll just take it all the way through, step by step. We're here at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject and see if we can apply this or another matrix to what's happening with you. Want to remind you to visit our website, rosellecare.com. That's ROSELLECARE.com. And did you know if you go in and you click on our business Facebook accounts, you don't have to have a Facebook account on your own, but you can go in through our website. There's an ongoing blog there of health tips that we post several times a week on different subject areas. Go in, they'll stimulate, you can get in touch with us, you can ask me questions. I encourage you to do that. It's really very interesting exploration. RoselleCare.com. Let me know what you think about it and what we can do to make it better, and also what we can do to make this program better for you. 888-630-9625, talking about allergy problems. A little bit later in the show, we're going to talk about a very special substance that seems to delay the progression of Alzheimer's disease. We'll get into that in the second half of the program. So, as we're talking about allergies and sensitivities, we have to realize that there's a breakdown in the body's ability to protect itself. There's a breakdown in the body's ability to handle this stuff, and sometimes it's not. It's simply the body not producing enough hydrochloric acid that's produced in the stomach. You know, we go out and we watch all the commercials and say you have to take this drug to suppress your hydrochloric acid because God forbid that you have too much, you're going to get GERD, you're going to get erosion. Well, hydrochloric acid is supposed to be in your stomach, and it's supposed to break down proteins and help you absorb calcium and begin to stimulate the production of other enzymes in the upper part of the intestinal tract. When you take those medications, then the body begins to lose that capacity. So calcium goes out the window, proteins don't absorb, B12 levels, and I mean, it goes on. It's an unfortunate cascade that ultimately sets the stage, if you will, and that's just one cause. How many of you over time, we talked about antibiotic therapy and just knocking, your intestinal system out and suppressing the immune reaction, but we also look at the foods that we put in our body. When you eat a piece of chicken or you eat a piece of meat or you eat something that has been raised by a manufacturer, they've generally, unless it's organic, unless it's free range, they've injected it with all kinds of things, steroids and growth hormones and antibiotics and so forth, as a preventative measure. Well, when you eat that animal, you get those things that the animal got, just like nursing from your mother. We're going to talk about that and how it affects your body and many more things as we go on the rest of the program today. You're listening to Dr. Tom Roselle Live. Love to talk to you on any subject at 888-630-WMAL. Don't go away. We'll be right back.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am live in studio. 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem. Well, let's put the fire out. We're talking about allergies today, and you'd be very surprised what happens when allergies kind of are not looked at. You know, patients come into our practice and they have back pain, they have autoimmune problems, they have migraines, whatever it is. We look at the whole picture. We look at the structural, chemical, emotional pathways because it's important that you eliminate all of those things that can affect the body. If somebody has a problem with their spine,